Welcome to this video clip on the impacts of the pandemic on the most vulnerable populations in Quebec by Observatoire québécois des inégalités. The Observatoire québécois des inégalités is a broker of scientific knowledge regarding inequalities in Quebec. The magnitude of the health crisis related to COVID-19 and its socioeconomic repercussions is major and unprecedented. Through the Resilience Project, the Observatoire proposes an inclusive way out of the crisis by paying particular attention to Quebecers with the lowest incomes. In order to better identify the vulnerability factors and resilience strategies of these individuals in the face of the public health crisis, an investigation was conducted in 2 stages. An online survey was first conducted in July 2021 with a web panel of 1,354 adults residing in Quebec, speaking either French or English, and belonging to the population with the lowest incomes. 3 rounds of interviews were then conducted between August 2021 and February 2022, that is to say during the 4th and 5th waves of the COVID-19 pandemic, with 50 volunteers recruited from among those surveyed. 4 reports from this investigation were then published in 2021 and 2022. This investigation is nevertheless limited because it did not examine the full range of impacts of COVID on vulnerable populations in Quebec. It was completed by a review of the scientific literature. Research indicates that people who are at the intersection of several axes of oppression and discrimination, and who were already vulnerable before the pandemic, have seen their living conditions deteriorate in the pandemic context. The main gendered, social, and racialized impacts of the pandemic on women with the lowest incomes are job loss and economic security, social isolation, mental and physical health, access to housing, food insecurity, which refers to the inadequate access to food due to lack of financial resources, homelessness, which is related to the exposure to violence, including domestic violence, and to financial insecurity, and finally, domestic violence. With regard to the difficulties encountered, the survey question was, please indicate the top 3 things that are an issue for you currently, that is to say in July 2021. 37% of respondents, both men and women, reported being concerned about their mental health, 34% about their personal finances, and 32% about their physical health. Concerns also included accessing and maintaining employment, food security, and educational success for children. The pandemic particularly affected women and people from immigrant and racialized communities who experienced more job losses, more frequent shifts to part-time work, and more difficulty balancing family and work. Job losses in the first year of the pandemic were more frequent in part-time, low-wage work and small service sector businesses, where women are more likely to be employed. The pandemic is thus indicative of the gender division of labor and roles. Women have taken on a greater share of childcare and homeschooling, as well as care work, for instance, as nursing staff and beneficiary attendants. Women with the lowest incomes have played an invisible but essential role in many ways, as grandmothers in caring for their grandchildren, some even retired earlier than expected, as mothers in supporting their adult children, and as citizens in helping their neighborhoods and communities. In a context of school and daycare closures, family responsibilities have increased, and they were already falling more onto mothers. As a matter of fact, 42% of women who were surveyed expressed concern about their own mental health during the pandemic, compared to 32% of men. Several population groups also experienced a decline in mental health during the pandemic, especially young people, students, healthcare workers, and racialized people. Physical health was also a concern for various low and moderate income populations, but this time it was the immigrants who seemed to be the most affected in a much larger proportion. 40% reported being in poorer physical health at the time of the survey, while this was the case for 30% of non-immigrants, that is to say those born in Canada. Personal finances were also an issue for about 1/3 of those surveyed, 34%, and people with disabilities reported being significantly more affected in their personal finances, as this was the case for 44% of these people in the summer of 2021. Another important impact of the pandemic was the feeling of social isolation. The survey question was, currently, that is to say in July 2021, how isolated do you feel from others? According to this survey conducted in the summer of 2021, 1 in 3 people reported feeling very or somewhat isolated from others after 3 waves of COVID-19. And this proportion can be considered important in the summer context where several health restrictions were put on hold. The survey showed that feelings of isolation are closely linked to a lack of financial resources. Almost half of respondents who felt isolated were also concerned about their personal finances after 1 year of the pandemic. Another video clip is dedicated to this question in the series of video clips on the Resilience Project. In short, as already mentioned, several factors may reinforce vulnerability in the face of the pandemic. These include insufficient income, job insecurity, inadequate housing, social isolation and illness, and the lack of access to healthcare services. But fortunately, there are also protective factors that make it possible to be resilient in the face of the health crisis, such as sufficient or stable income, better working conditions, access to affordable housing and social housing, access to healthcare and community activities, and being healthy and having people around you. And this list is not exhaustive. Finally, the pandemic may have had positive effects, as many interviewees reported, such as spending more time with the family, cooking more, or taking care of themselves. To learn more about the Resilience Project, we invite you to visit observatoiredesinégalités.com, where you can find 4 synthesis reports and 4 highlight papers. Thank you for viewing our video clip.